Over the years, several surveys have been done about defilement and teenage pregnancies. The figures are staggering. According to the Population Secretariat, of the 1.2 million pregnancies recorded in Uganda annually, 25% are teenage pregnancies. And the recent demographic health study of 2016 shows that 25% of adolescents aged 15 to 19 in Uganda have begun childbearing. 19% of women aged 15 to 19 have given birth, and another 5% were pregnant with their first child. The study also shows that most of these are in the rural areas. However, Kigezi region was marked as being one with the least teenage mothers countrywide at 16%. But medical workers in the region hold a different view from that of the UDHS report.
Our deliveries here in Paris Center of teenage pregnancies, I think the percentage should be a bit higher than 8.2. In the community, some teenagers are harassed and they end up delivering from the community.
Here in Kabale, we spoke to 3 teenage mothers, all below the age of 17. They unequivocally say they were not ready to be mothers. The Uganda Demographic Health Study does not capture the causes of the teenage pregnancies, but most of them say they were raped.
Most of them tell us that they were defiled. Some they say by unknown people. Others say by their classmates, such things.
Rape and defilement in itself leaves devastating effects on victims, which sometimes lead to unsafe abortions because such pregnancies are as a result of sexual coercion instead of informed choices. In 2013, the annual crime report from police recorded 9,598 cases of defilement. Despite this being an offense, the ladies are not willing to have their unofficial partners arrested. We asked the medical workers if they have reported these cases to the authorities.
I think last year we handled like 2 cases. We sent the family protection unit.
The UDHS report shows that the proportion of teenagers who have started childbearing decreases with increasing levels of education. 35% of girls aged 15 to 19 have not attained any education compared to 11% with an O-level certificate. All the girls we spoke to had attained some level of education, the highest being S4 and the lowest being a primary 2 dropout. Some of the mothers to these girls told us they would not let their daughters continue with school. After getting pregnant, the girls too lose interest for school. Most of the girls in Chisoro have now turned to manual labor in stone quarries to earn a living. We visited Chisoro Hospital to establish the magnitude of the problem.
10 to 19, we have 36. 20 to 24, we have 90 mothers. Above 25 years, we have 112 mothers.
These statistics explain why a proposal by government to introduce contraceptives to teenagers drew criticism from the civil society and religious leaders. But what do the health professionals think about the proposal?
It's a good call because these younger ones, as they got married at age of 19 years, they have some challenges. Their men leave them at home, they go to Kampala, then you find the mothers are left with their children, nothing to eat, so we told them to join family planning so that they can space their children.
Winfred Mujisha the nursing officer here, says the government should improve on the availability of services, especially in the hard-to-reach areas.
We need to go more and advocate on sexual reproductive health services for these adolescents.
Several policies have been designed to protect teenage girls from getting pregnant, such as the National Health Policy, the National Adolescent Health Policy, the Sexual Reproductive Health Minimum Package, the Minimum Age of Sexual Consent Policy, and the Defilement Law, among others. The setback has been in implementation. Walter Mwesije, NTV.